Taking the mystery out of Medicare, episode number 231. It is my good fortune to bring Dr. Katy Votava onto the program this morning. She is the president and founder of goodcare.com. Let me tell you a little bit about her before we bring her on. So Dr. Votava is a registered professional nurse and has a PhD in health economics and nursing from the University of Rochester in Rochester, New York. She completed a pre-doctoral fellowship in community and preventative medicine at the University of Rochester and a postdoctoral fellowship at Harvard Medical School. Before starting goodcare.com, Dr. Votava worked as the director of clinical specialties and education at Visiting Nurse Service of Rochester and Monroe County. With her in-depth experience as a nurse practitioner and healthcare administrator, Dr. Votava is an expert in healthcare reimbursement and outcomes, including those related to Medicare, Medicaid, and long-term care. And this next part, and I'm really excited about, but a major focus of Dr. Votava's research is healthcare costs for people during their retirement years. And she's been published widely and frequently spoken on these topics. Together with other healthcare experts in their respective fields, Dr. Votava and her staff work to develop customized solutions to clients' questions and solve their healthcare puzzles to help more people get the information they need about planning and paying for healthcare. In 2004, Dr. Votava created goodcare.com, an online source of information, resources, and free tools. Dr. Votava, thank you so much for being a guest on Sound Retirement Radio.
Well, thank you so much for having me today, Jason. It's my honor and pleasure to be with you and your listeners.
Yes, this is going to be a good one. Medicare can be a bit confusing, and I'm excited to dive into this with you. But before I start asking you questions about Medicare, your career path, starting out as a RN and now working as somebody that's consulting in this field, tell me a little bit about how that came to be.
Yeah, the long and winding road, or the yellow brick road of my career. And as many people know, over the years, you do various things over time. I've always been a nurse, but early on in my career as a nurse practitioner in home care, and I was a young nurse practitioner just starting out in home care at a Visiting Nurse Service in Rochester, New York, I learned that I needed to understand what healthcare cost and what Medicare had to do with it and any other insurance. And that was actually over 35 years ago. And when I learned that then, because if I didn't understand Medicare and all the ways care would be paid for, I could not take good care of my patients, pure and simple. And so I followed that path over my years, and that's how then I went on for the PhD to study and started my own company, Good Care, because everybody wants good care.
Yeah, that's great.
So and it's my passion to take care of people.
Well, and I want to let our listeners know you have a book that's going to be updated for 2020. It's going to be coming out soon called Making the Most of Medicare, a guide for baby boomers, the #1 bestseller on Amazon in the category of Medicare, which is pretty cool. So that might be a resource they want to check out. I want to ask you, we're going to dive into some of the details here on Medicare, but just at a high level, do you think Medicare is a good value? So if we're comparing somebody who's age 64 before Medicare and then 65 after Medicare, is Medicare a good value compared to what they would be paying for health care coverage at age 64?
Certainly. Well, Medicare can be a very good value for people at 65, or many people under 65 because they're medically disabled and are eligible for it too. And the most important thing, how it can be not so great a value, is when people don't understand Medicare. So I'm so glad to be with you and your listeners today, because it's been proven in large studies that 90 to 95% of folks on Medicare overspend. And that's a shame when they've worked so hard and saved their money and are on a fixed income. And they overspend because they don't understand Medicare and they don't understand how to shop for coverage to meet their needs. So it's all about the details and understanding some basic things, and it can be overwhelming and even confusing to begin with, but there are basic things people can learn to position themselves better so it's the best value for them at 65 and beyond.
Okay, well, that's why we're doing the show. We're going to take the mystery out of this today. I want to start at the very beginning. The very first question is, when should most people enroll in Medicare?
Well, most everyone in the United States is eligible to enroll in Medicare when they're 65 years old. And that is been the case for a long time. Now, full retirement age is a little beyond 65. It's 66 and then moving up. So people confuse Medicare with full retirement age. So it still is 65. And what I say is read the meter, the Medicare meter, I call it, when you're 64 or maybe 63, to look ahead and say, where will I be when I'm 65? Do I need to enroll now? Because many people are working beyond 65. And if they are, they may need part of Medicare or they may need none of Medicare. But read the Medicare meter when you're 65, understand your circumstances and what other options you may have, and then you are prepared to make that choice when you're 65 and beyond that.
Yeah, and when you say full retirement age, you're referring to Social Security full retirement age. Medicare enrollment is age 65. And so what about if you're still working and you have insurance through your employer? Are you required to enroll in Medicare then?
Okay. If you are still working or your spouse that provides coverage for you is still in the workforce and getting coverage, you're actually not required to apply for Medicare unless your plan doesn't meet certain standards, particularly with the prescription drug coverage, the Part D type of benefit. But most do now. Most of them do. But you want to be careful about, do I need to enroll at 65 or not? Even if you could delay, which you can. It's sometimes a good idea because if you really like the coverage you have and it's economical, you want to keep it. If your current coverage isn't working very well, then you have an alternative to go elsewhere, and you want to consider that option as well for yourself. So whether to get in or not at 65, you determine. And then even if you have current coverage and you stay with your coverage, should you get into Part A, which is the hospital portion, and that's the part we've all prepaid for. But be careful about Part B because that's outpatient, all the outpatient services, seeing doctors, having MRIs, outpatient surgery. There is a premium for that. None of us have prepaid, and if you don't need that coverage, you can defer it till sometime in the future. But there's always an exception. And that exception is for those who are employed, but in a small company, and in Medicare's definition, a small company is 19 or fewer people who are eligible for coverage. You don't have to enroll in Medicare A and B, but if you don't, the problem is your current employer coverage will only be a secondary. It'll only cover about 20% of your needs because by law, Medicare, whether you have it or not, needs to be your primary. So as long as you're in a company, here's the rule, 20 or more, you like the coverage and it meets Medicare standards, you can stay in it if you like, and then you are allowed to defer, this is really important, to enroll in Medicare till sometime in the future, and then you can enroll when you want to. Say a person retires at 67, 68, and you can get in without a penalty or a delay. At that point, we want to really understand those rules because those are places where I see people get tripped up more often than any other.
Yeah, that's really.
And if you don't understand, the worst thing is to see a person who thought they were doing the right thing and tried hard, but they were given well-meaning but perhaps not good advice. And then down the road, they can't get into Medicare when they need to, and they might pay a penalty. You can pay a penalty the rest of your life for not getting into Medicare on time. So it's important to really check it out ahead of time.
And what is the penalty?
The penalty for not getting into Medicare Part B in a timely basis is 10% per year on the base premium for every year a person isn't in there. So on average, when people don't get in, it's about 3 years. The data shows so it's about 30%, and the base rate is about 140 something a month right now. So you're going to pay 30% more. And there's a penalty to not get into Part D for a prescription drug, and that penalty is 12% per year for every year a person isn't in there. So over 3 years, it'll be 36% more on premium for the person. And often, if you have a couple, if one member of the family was supposed to be in and the other one's over 65, they probably both followed the same advice, and so they might both be in a penalty position. And so that means each person who's paying their own penalty is going to pay 30% more for Part B on average and 36% more for Part D on average.
Wow. Yeah, so very important that you get the timing of this right, and just something as simple as the number of employees in the company can determine whether or not you're eligible. That's really good to know.